Hi, so we're ready to start the microblading procedure. Vicky's all numbed up, we've sketched her eyebrows, we've made sure that she is exactly happy with the colour, the pigment we've chosen, we've tested it, we've left it on the skin for a little bit, we've got all the tools and the things ready, we've drawn the brows, we've planned them out. That takes quite some time, but we are ready to go. So what we do now is make sure the area is nice and tidy and clean, hygienic. You only have what you need on the top tier of your trolley. I'm going to open this blade. I'm going to use a slanted blade, 17 needles in this blade. It's very fine, ultra fine. Each and every single client has their own individual blade per treatment. You never ever reuse a blade, and that's purely because you're working with blood. You do not use a blade from one client to the next. These are fully disposable. I've got a very big sharps box, and every time I finish with a client I put the blade in the sharps box. So if I just show you, my tool is an EpiBrow 17 prong tool, handheld, fully disposable. And I'm going to start blading. So I've got my pigment, we've mixed a brown, just very good, nice and dark but not too much for Vicky. She needs a nice result. We smudged a little bit of the prep because we replanned. Make sure you've got some good light, and then we're ready to go. Are you ready, Vicky?
Mm-hmm.
Constantly check with your client to see what their pain threshold is. Lift you up a little bit, and here we go. So we're dipping in the pigment. We're going to start making our first passes. I'm going to go stretch the skin and go with the hair. I've made some dots as well to try and guide myself to where I'm going. Stopping and starting, basically. Making a few initial strokes just to show myself where I am. Going over some of the old strokes that I gave Vicky. How does that feel, Vicky? Pain threshold, pain-wise?
That's absolutely fine. Not even a 1. The numbing cream's done its job. How long does the numbing cream last?
So it depends on from person to person again, but usually a good half an hour while I'm busy blading, but I will reapply as well. So I go from one brow to the next to get it absolutely even.
Mm-hmm.
And then we'll sit you up in a minute when I've done a few passes and just check that we've done a good job so far. So I work from the inside corner of the brow towards the outside. Don't be afraid to push hard, but make sure you use your blade upright and very, very parallel to the skin.
Do people bleed a lot?
Yeah, some people can bleed a little bit. Other people just bleed but then stop bleeding as well.
I remember when you did them the first time, you said I was a bleeder.
Yeah, you do. You've got a little bit of seepage here. Such a good word, isn't it?
Mm.
So I'm following the natural shape of your brow, making sure that I fill in. Going over. So I'm just gonna pop some extra pigment on the area now where I've already bladed. And I'm going to leave that on for about 5 minutes, just so that the ink can really penetrate into every pass that I've made. And then I will see if there's any last minute corrections that I need to do. How's it feeling, Vicky? I think at this point the general gist, or the general feeling, is that it's actually warm, almost like a bit of a sunburnt feeling, right?
Yeah.
And it feels,
I can feel this more
stingy.
I can feel this more than
The actual blading.
the actual blading, yeah. Yeah, it feels like a little bit of sunburn.
Yeah, and I think now, because the skin is already broken, we are actually putting this ink straight into broken skin, and it's what makes it a little bit more sensitive. But I always look at the surrounding areas. There's a little bit of redness where I've been holding and pushing and pulling, but the actual area around the eye doesn't look swollen at all to me, so I'm pretty happy. You have bled a lot. You are quite a sensitive, your capillary network's quite close to the skin surface, so you tend to bleed a little bit more than some people. But other than that, I'm not worried about it at all. It looks really good. We've had a good outcome so far. We'll just pigment up now, and then we will see what the outcome is. So we've just had the ink on for 5 minutes, and we're just going to remove with some wet cotton pads. Cools the area down a little bit as well. Just clean the area off. After this bit of inked time, we can see where we have gaps and then fill them in, and then not a lot of work to be done. They look nice and full already. Then we can finish up. You see my passes in there? I need to put a couple more in here and just make sure that I've got the spot on in the middle. So we've just removed all the pigment. I'm just going to check through. Nice long hair there. Can you see my passes in there? What do you think so far, Vicky?
They're good. Very good.
There's a few dots there where I've measured with a tattoo pen, but that should fade in a couple of days. So, or maybe even by tomorrow, you'll have a good fade on that. You need to know everything about aftercare now. Are there any questions before I start reading you the right act about aftercare?
I was just going to ask how long they will take to heal.
Okay, so again, everybody's different. Lift your head up, please. Everyone's different. Healing depends on a lot of factors. Usually depends on your skin type and how oily or dry you are. So we finished the treatment. Vicky feels good. Her brows look amazing. She's got the fresh brow act going down here. She needs to just do her aftercare properly now. I think the most important thing is that you don't get the brows wet. So no swimming, no saunas, no steam baths, no jacuzzis, anything like that, because a lot of moisture will just make you sort of sweat and the brow will just lift off and all the scabbing will come off. They might scab, but I have to say my brows very, very rarely scab over. You get a little bit of dryness sometimes underneath where the scab's occurring. You see them flake off sometimes. The most important thing is not to scratch the area, to itch the area. If the area is itchy, you can apply a little bit of the aftercare balm over and around the area with a cotton bud and just give it a little wiggle, but you don't have to go over the actual brow area that I've treated. The aftercare balm is good to start using 24 hours after the treatment. I like the brows to sort of dry out a little bit after I've treated them, because they are a little bit moist with a little bit of maybe some blood and some pigment that's still on the skin. So let them sort of start healing for the first 24 hours by themselves, and then you start applying the aftercare balm That again, once a day is enough. And I think maybe for a few days. You don't have to do it for the full week. My brows heal really, really quick. So I think the main thing to remember is to keep them dry and just to treat them like you would, you know, a very sensitive area. Look after them.